Hi again, it's Veronica. This is our final segment of the Prenatal Yoga series, Series 7. And for this series, we're going to cool it down. So let's start in downward facing dog. Place your hands on at shoulder width distance, feet at hips distance. Lift your hips, press your thighs back. Take a full breath in. And from here, lift your right leg up. Exhale, bring your right knee to your right wrist for half pigeon. So you'll angle your front shin accordingly to how tight your hip is. So if the hip is super tight, you can bring the right heel closer to you. Otherwise, bring the right shin more parallel to the front edge of your mat. If you find that you're kind of sinking onto one hip, it's a good sign that you want to use some support. So you can place a block, maybe a rolled up blanket, towel, pillow underneath your right hip. Tuck your back toes under and look over your right shoulder to see that that leg is in line with your left hip. It's not like way off to the side, yeah? Inhale, lift your heart, lengthen your spine. Stay right here. Maybe come onto your forearms. Perhaps take a pillow, block, blanket, and relax your forehead on that. Let's take a good 8 deep breaths here to really work the outer right hip, get into the connective tissues. And as you connect to this deeper part of your body that maybe you haven't before, soften. Listen to your breath and practice what's known as a roving body check. And this is something that when you're in labor, you can do, and it's really effective in helping labor to progress and to help relieve any tension, any anxiety that you're feeling, which is very normal. So, starting at your forehead, soften any tension that you feel. Unhinge your jaw. If there's any tension in the jaw, that actually prevents the pelvic floor from releasing, making birth longer. So just let the jaw drop. Relax your shoulders. Just give your whole body to the ground here. One more breath. From here, come up onto your hands and press back to downward facing dog. You can pedal the legs, shift your hips. And then let's switch sides. Lift your left leg up. Exhale for half pigeon, left knee to your left wrist. You might have a different setup on this side. We're naturally asymmetrical, but yoga is going to help to make the pelvis more symmetrical, which is also really great for pregnancy, birth, postpartum period. Support yourself underneath the left hip if you find that you're kind of sinking or your butt sticking way up in the air. Look over your left shoulder and see that the right leg is totally straight in line with your right hip. Inhale, lift your heart. Stay there, or again, hinge forward. Scan your body head to toe for any resistance, any tension. And instead, with each exhale, let that go. Practice surrendering to gravity. Just get heavy on the ground. Breathe deeply with your baby. It's pretty common in pregnancy to experience some sciatica, so some pain or tension in the outer hips. And this pose is really therapeutic for that. Take another 5 deep breaths. As you inhale, come up onto your hands. And again, press into down dog. Recirculate some energy through your legs. Pedal the knees, your heels, back and forth. And then come down to your knees. Lengthen both legs out in front of you. Let's set up for Jani Shavasana. From here, pull your left heel in and widen your right leg over to the right. Use your right hand on your inner knee as leverage to spin your heart up and over to the left. Sweep your left arm up and overhead. Stay here or start to slide your right forearm towards the ground, maintaining that lift through your heart. Your left sit bone might leave the ground, that's fine. Just keep reaching through your left hand, stretch the skin on your left side body, and turn your heart high. One more breath here. Inhale, come through to center, and let's switch sides. So widen your left leg over to the left, right foot in. Again, use your hand on your inner knee to spin your heart up. Reach your right arm up and overhead. Stay here or come onto the left forearm. Continue to pressurize your left arm to your inner leg and turn your heart up towards the ceiling. Full deep breaths here. Inhale, come through to center. Let's take both legs out wide. For Upavishta move your buttocks flush back. Flex your toes towards your face. Again, sitting up on a blanket, especially for this one, can help to remove any rounding in the spine. You want to feel always that you're tilting the pelvis forward. Lift your heart. Stay right here. Or come onto your fingertips. Maybe walk the fingers forward. Stack some blocks or some books up to place your forearms on or bring them to the ground. And just pause here for a good 5 to 10 deep breaths. Breathe into your inner legs, your abductors, which connect all the way up to the pelvic floor and help release tension there. Really effective in preparing the pelvic floor for birth. All right, a couple more breaths. If it feels good, you can stack your hands, relax your forehead on them. And inhale, lift up. Keep your legs nice and soft as you use your hands to guide them together. And let's take one final twist. So soles of the feet together, let your knees splay open. Bring your left hand to your inner leg. Gently twist over to the right. And then switch sides. So again, you're always taking an open twist in Prenatal Yoga, meaning there's no compression between your belly and your front leg. Inhale to release. Use your hands to guide your knees together. And let's set up for Shavasana. So, if you have pillows, blankets, I highly recommend grabbing that. I have these blocks I'm going to use. Lying on your left side, as you probably heard, is optimal not only for circulation in pregnancy, but also in aligning baby in that optimal position. So come down onto your left side body. You can use a block or a pillow underneath your head, and then create some space in the low back by bringing a block, a pillow, maybe some towels in between your inner legs, your inner knees. And close your eyes. Let your breath settle into its normal rhythm. And allow you and your baby to be on the receiving end of your practice, to soak up all the benefits, all the hard work you put into this practice. Let you and your baby be cradled by the ground underneath you. Rest here for at least 5 minutes. From here, start to deepen your breath. Awaken through your inner body. Invite your baby to reawaken. Start to move your fingers and toes. Roll out your wrists and ankles. Gradually let this movement build. Bring your hand to the ground in front of you and use that to raise up. Set your block or your pillows to the side and let's set up for one final seated meditation to close your practice. You can sit up on a blanket, block, some stacked books, cross your legs, or take Padappanasana again. Sit well, sit up tall. Exhale to just soften your skin. Again, place one hand on your heart, one hand on your baby, and breathe deeply. Remember your intention and visualize that little being growing inside of you. Give yourself permission to trust in this process, to trust yourself. And again, remember that you, more than anyone else, know how to give birth to your baby.